Protection wants every kitten born to have the best possible start in life, and that begins with caring for your cat before, during and after giving birth. During the breeding season, which usually runs from February to August, unneutered females have periods of being in heat when they can become pregnant. These periods occur every few weeks and last a few days each time. You might be surprised to learn that female cats can become pregnant from just 4 months of age, and can also become pregnant again just 6 weeks after giving birth. They're not selective in their choice of mate and will accept advances made by any male cat, including relatives, which is why so many kittens are born each year. If you have an unneutered female cat who is more than 4 months old and is going outside, they're very likely to become pregnant quickly, which is why Cats Protection recommends you have your kittens neutered at 4 months old and before they're let outside to avoid any unwanted pregnancies. If you discover your cat or kitten is already pregnant and the pregnancy is unplanned or there are potential health risks to the queen or kittens, you may wish to speak to your vet to discuss your options. The gestation period for a cat is 63 to 65 days or 9 weeks. Often there will be minimal signs your cat is pregnant until very near the birth. However, the main signs to look out for are a swelling of the belly area, which will start to occur from 3 weeks into the pregnancy, the cat's teats becoming larger and redder in colour, increased maternal behaviour, purring and showing more affection than normal, and reduced tolerance of other pets in the home. If you're caring for a pregnant cat, known as a queen, there are a number of steps you can take to make the experience as stress-free and as comfortable as possible for her. The cat will need to identify her own birthing area, but you can help this by placing blankets down in quiet areas of the house to act as birthing areas. Pregnant queens need to eat more than usual, especially in the last 3 to 4 weeks of the pregnancy. And at this stage, it's advisable to feed her kitten food, which is dense in energy and essential nutrients to help support the kitten's growth. Offer her an additional meal each day, and if she wants more, allow her to eat as much as she needs. She'll be able to regulate her own intake. Water intake is also essential, so ensure this is put down and changed at least twice a day. As the pregnancy progresses, place additional food and water bowls around the house to allow easier access for her. This is the same for litter trays and quiet blanketed areas. If your cat's already pregnant, you should seek advice from your vet about their specific care regarding feeding, worming and flea treatment. You should ensure any treatments are safe for use during pregnancy. If you have any concerns at all about your cat's health during her pregnancy, you should consult your vet as soon as possible. The best way to care for your pregnant cat is to observe her vigilantly, quietly and preferably from a distance, taking care not to cause her any unnecessary stress, such as loud noises or having lots of visitors in your home. At stage 1 of the birth, you may see signs of your cat nesting, where she would choose a quiet place to sit and start to paw at, and arrange blankets for a birthing area. When the labour begins, there are intermittent contractions but no straining. This can last up to 36 hours, but is usually shorter for cats who have given birth before. At stage 2, the queen will start to visibly strain and the kittens' heads will be seen. Once each kitten has been born, their mother will chew through the umbilical cord and start to lick the kitten. This cleans the newborn and encourages them to start breathing. Stage 2 can last 5 to 30 minutes for each kitten. Stage 3 is the passing of the placenta or afterbirth. The queen's natural instinct will be to eat the placenta in order to hide evidence of the birth and protect her offspring. However, you should try and ensure that a placenta is passed for each kitten, so be as attentive as possible from a safe distance. And if you believe all placentae have not been passed within 4 to 6 hours after the last kitten is born, you should seek advice from your vet. Placing a baby monitor in the birthing area so you can observe from an alternative room could help here. The time between the delivery of each kitten is usually 10 to 60 minutes, and stage 2 and 3 will be repeated each time. Between 1 and 9 kittens will be born in a litter, but most commonly 4 to 6. The whole litter will usually be born within 6 hours of the first kitten being born, but it can last up to 12 hours. When the birth is finished, the queen will settle and allow the kittens to feed. After the birth, you should ensure that the mother cat has access to food, water and a litter tray nearby. It's a good idea to elevate food and water bowls for the queen to prevent the kittens from climbing into them and becoming trapped or drowning. Cats are amazing at managing their own labours, but occasionally they may need intervention. You should only ever intervene with the birth if absolutely necessary and under guidance from a veterinary professional. So Cats Protection advises that as soon as your cat goes into labour, you call your vet to make them aware you may be in contact if any issues arise. You should call the vet for advice during the birth if, during stage 1, there is panting and returning to the bedded area frequently for longer than 24 hours without any sign of straining. There has been straining for more than 30 minutes without producing a kitten. This could indicate an obstruction. There is excessive bloody discharge. A kitten is stuck halfway out and cannot be delivered. The queen does not bite through the umbilical cord. During stage 1 of labour, you should have the following in place in case you need to intervene: clean towels and kitchen roll, a warm hot water bottle, a feeding bottle and some specialist cat milk replacement, not cow or goat milk, sewing thread and surgical scissors. You should also ensure your hands are very clean or you wear surgical gloves. If a kitten has been partially out for longer than a few minutes, but the queen is very tired and cannot pass the kitten, you can try to gently pull it out yourself. Approach the mother very quietly and carefully, get down to their level and gently pull the kitten down. If the queen does not clean the kitten, you can quickly clear the membranes from its head with a clean, soft kitchen roll. Wipe its nose and open the mouth to clear it. Rub the kitten in small circular movements to get it breathing. If the queen does not bite through the umbilical cord, you can tie it off twice with clean sewing thread, around 3 centimetres from the kitten's body, and gently tear between the 2 ties. The umbilical cord should dry out quickly and remain dry until it naturally falls off around 3 days after birth. The queen should be carefully monitored after the birth. If there are any problems such as a discharge from the genital area, prolapsed womb or any kind of erratic or disturbed behaviour, you should seek veterinary advice as soon as possible. Try not to approach the queen or newborns after the birth, as there's a risk you'll disturb the natural bonding that needs to occur between the mother and her kittens. If this happens, there's a chance the queen will reject them, or even worse, kill them. Newborn kittens can lose warmth very quickly, particularly if the mother is avoiding them, but you can provide them with a well-covered, warm hot water bottle or heat pad, no hotter than body temperature, and or cover them with a lightweight towel or blanket. Keep the room temperature warm and the bedding clean and dry. Newborn kittens should start to suckle from their mother almost immediately and must feed within 2 hours of being born and every 2 hours afterwards. It's essential kittens receive the colostrum from their mother's milk, as it contains antibodies to boost their immune system. If they haven't started to suckle after half an hour, gently guide them towards the teats. If any of the kittens don't start feeding, consult your vet as soon as possible. You may need to start giving a substitute milk replacement by hand. We hope you found this video helpful. For more information, please visit our website.